With the city set to begin phase one reopening on Monday, hospitals are preparing for a new normal, trying to figure out the way to balance the treatment of the remaining COVID patients with those who need more routine care. Lydia Hu spoke with officials from two of the hospital systems to find out what patients can expect.
The state's test for reopening New York City measures in part the region's preparation for a potential spike in COVID cases. Hospitals must have at least 30% of their total beds available and 30% of their ICU beds available. That's why hospitals in the Northwell Health System will continue to have surge patient capacity in place.
It's a new world, and obviously, as we do this all over, we will learn from it and we will see best practices.
Patients will also be required to check their temperatures the morning of an appointment, and engineers are refitting some patient rooms with ventilation systems that will prevent airborne particles from escaping.
And we've taken the step of also testing every patient that's admitted, whether they have COVID symptoms or not, so that we are aware if a patient came in who may have been asymptomatic.
St. Barnabas Hospital in the Bronx will also test all admitted patients for COVID, so asymptomatic people can be identified and treated separately in order to contain the spread of the virus. A challenge for this hospital, says Dr. Appelbaum, will be knowing exactly how much PPE to require. The state mandates a 90-day supply, and the hospital must plan not just for the emergency room staff, but also new needs from outpatient care providers like dentists.
So we're cautiously optimistic, I'd say, is the best way. We are keeping a very close eye on that.
But with increased infection control measures in place, the doctors say there is no reason to fear a trip to the hospital should the need arise.
A month ago, if you said I had to go to any ER with a sprained ankle, I would have been nervous. But now I feel a lot better. I feel I'm just as safe going to an ER as I am going to a supermarket.
Lydia Hu, New York 1.